Welcome to today's Medicare 360 show. I'm your host, Jennifer Lee, and we are going to continue our journey on the Medicare New Handbook. We are at page 95, and we're going to go over Medicare and Medicaid plans. So, get help paying your health and drug costs. Medicare works with some states and health plans to offer demonstration plans for certain people who have both Medicare and Medicaid to make it easier for them to get the services they need. They're called Medicare-Medicaid plans. These plans include drug coverage and are only available in certain states. To find out if a Medicare-Medicaid plan is available in your area, visit medicare.gov/plan-compare, enter your zip code, and select Medicare Advantage Plan Part C when asked if you get help with your costs. Select Medicaid. A list of all available plans will appear, and the demonstration plans will have Medicare-Medicaid plan next to their name. So the state pharmaceutical assistant programs. These are programs that help certain people pay for prescription drugs based on financial need, age, or medical condition. To find out if there's a state pharmaceutical assistance program in your state and how it works, call your state health insurance assistance program SHIP. Go to pages 114 to 117 for the phone number or your local SHIP. And also visit medicare.gov/pharmaceutical-assistance-programs/#state-programs. Pharmaceutical assistant programs, also called patient assistant programs. Many major drug manufacturers offer assistance programs for people with Medicare drug coverage, Part D, who meet certain requirements. Visit medicare.gov/pharmaceutical-assistance-program to learn more about pharmaceutical assistant programs. Program of all-inclusive care for the elderly. PACE is a Medicare and Medicaid program offered in many states that allows people who need a nursing home level of care to remain in the community. Go to page 74. Supplemental Security Income SSI payments. We are at page 96 now. SSI provides monthly payments to adults and children who are blind or have a disability and have limited income and resources. SSI payments are also provided to people 65 and older without disabilities who meet the financial qualifications. You may be able to get both SSI and Social Security benefits at the same time. If your Social Security benefits is less than the SSI federal benefit rate. If you're eligible for SSI, you qualify automatically for extra help and are usually eligible for Medicaid. You could visit ssa.gov/apply/SSI to find out if you're eligible for SSI or other benefits. Note, people who live in Puerto Rico, the U.S. Virgin Islands, Guam, or American Samoa can't get SSI. Programs for people who live in the U.S. territories. There are programs in Puerto Rico, U.S. Virgin Islands, Guam, the Northern Mariana Islands, and American Samoa to help people with limited income and resources pay their Medicare costs. Programs vary in these areas. Call your state medical assistance Medicaid offices to learn more. Visit medicaid.gov medicaid.gov/about-us/beneficiary-resources/index.html #state menu or call 1-800-MEDICARE to get the phone number. Okay, on to section 8, your Medicare rights and options, page 97. All people with Medicare have certain rights and protections. You have the right to be treated with courtesy, dignity, and respect at all times. Be protected from unlawful discrimination. Have your personal and health information kept private. Get information in a way you understand from Medicare, healthcare providers, and other certain circumstances, contractors. Learn about your treatment choices in clear language you could understand and participate in treatment decisions. Get Medicare information and healthcare services in languages you understand. Get your Medicare information in accessible format like Braille or large print. Go to Accessible Communications on page 124. Note, if you need plan information in a language other than English or in accessible format, contact your plan. Get answers to your Medicare questions. Have access to doctors, specialists, and hospitals for medically necessary services. Get Medicare covered services in an emergency. Get a decision about healthcare payment, coverage of items and services, or drug coverage. When you or your provider files a claim, you'll get a notice letting you know what will and won't be covered. This notice comes from one of these: Medicare, your Medicare Advantage Plan Part C, or other Medicare health plan, your drug Medicare plan. If you disagree with your decision on your claim, you have the right to file an appeal. You could request a review appeal of certain decisions about healthcare payment, coverage of items and services, or drug coverage. If you have concerns about the quality of care and other services you get from a Medicare provider, you could file a complaint, sometimes called a grievance. Get help from the end-stage renal disease ESRD networks and state survey agencies if you have complaints, grievances about dialysis or kidney transplant care. Your Medicare.gov or 1-800-Medicare to learn more about a filing complaint. Okay, so let's talk about this. Often clients call and tell me, Jennifer, my drug is not covered, and you told me my drug is covered. So sometimes the drug is definitely covered. It's just that pre-authorizations are needed, or like step therapy, which basically means that the insurance company wants to know that the doctor did all their power to, maybe get you a cheaper drug or generic drug, or this drug is the one that's particularly important to you or that works for you. So all is needed is an approval from the doctor, meaning the doctor does request and tell the insurance company that this person needs a drug based on X amount of reasons. So don't be alarmed if you do get a letter that says, oh, this drug is not covered. Not to worry. You call your insurance company, let them know that this drug is needed and to file an appeal. They will typically reach out to the doctor, and the doctor or the doctor staff needs to complete the information of why you need the drug to get that approved and carry on. The thing is, like the Ozempics and the injection drugs, that's been really popular nowadays. And I think most insurance companies would like to know if it's really needed. So take that in consideration. Even if a drug is not covered, you could still often file an appeal for that and see what happens. And we do that here in-house. We help you make that three-way call, get you going, and get that satisfied from your doctor. And those are the things that we do. Okay, let's go on to what are my rights if my plan stops participating in Medicare? This is a big one, so let's get started. Medicare health and drug plans can decide not to participate in Medicare for the coming year. In these cases, your coverage under the plan will end after December 31st. Your plan will send you a letter explaining your options if this happens. You could choose another plan from October 15th to December 7th. Your coverage will begin January 1st. We'll also have a special right to join another Medicare plan until the last day in February. So they do give you another month. You may have the right to buy certain Medigap policies within 63 days of your plan coverage ends. Okay, so the biggest thing on this, I gotta say, is that plans have been terminating recently. So it does give you an open enrollment to get on a Medigap plan without any underwriting, which is great because sometimes these plans, if you do have some illnesses or chronic conditions, they may automatically decline you for that plan. So that's a great option. Lately as well, it's not in this neck of the woods in California, but I think it's in Georgia. There is a insurance company that went under and is insolvent. So guess what happens? They're actually terminating all their plans September 1st. So that's quite crazy that this could happen. So I would say always get on a plan that has some stability and experience, and you just don't want to be in that mess. Of course, you're going to have an open enrollment period, so not to worry about that. But let's just say you're in the middle of some surgeries or some special things going on with your health that you need continuous care and things of that matter. And definitely you could file appeals and so forth for transitioning of care. So that's why working with a trusted insurance agent could help you guide you through that process of the ins and outs that you may not know. So keep that in mind. The biggest thing is I really try not to offer the plans that are smaller in the area just because this could happen, right? Typically, star ratings are lower, their service isn't as great, they just haven't been around to fix all that. But keep that in mind. Okay, so let's talk about an appeal. What's an appeal? An appeal is the action you could take if you disagree with a coverage or payment decision by Medicare or your Medicare plan. For example, you could appeal if Medicare and your plan denies a request for a healthcare service, supply, item, or drug you think Medicare should cover. A request for payment of healthcare services, supply them, or drug you already got. A request to change the amount you must pay for healthcare service, supply, item, or drug. You could also appeal if Medicare or your plan stops providing or paying all or all parts of a healthcare service, supply, item, or drug you think you need. An at-risk determination made under a drug management program that limits access to coverage for frequently abused drugs like opioids and benzodiazepines. If your claim is denied because of an open accident record and the claim isn't related to the accident. Okay. Okay. So if you're in the hospital and the hospital changes your status from inpatient to outpatient, or a hospital changed your status in the past, visit medicare.gov/status change to learn more. You must meet certain criteria to appeal your hospital status. If you decide to file an appeal, you could ask your doctor, supplier, or other healthcare provider for any information to make your appeal stronger. Keep a copy of everything related to your appeal, including what you sent to Medicare or your plan. Okay, so definitely appeals are good. Just the biggest thing that I do see is that if you are on Medi-Cal or Medicaid outside of California, sometimes these vendors or these companies don't know you're on Medicaid. So what happens is that they bill you. And typically, it could take 30, 60, 90 days to update. But if they don't have your Medicaid number, they're not going to know to bill Medicaid and not you. So what happens is eventually you ignore that bill and then it goes to collections. And sometimes when things go into collections or your bills go into collections, it is very hard to reverse, right? So I get it. Sometimes I think agents will tell you, oh, just disregard that bill. You're on Medi-Cal, Medicaid. But maybe after the first time, and if you still receive it the second time, that's when you really do have to call the vendor, the claim, and tell them, it's wrong. I mean, it's usually because you're on Medi-Cal or Medicaid. But I mean, if it is also wrong, like if you're not on Medicare, Medicaid, I would resolve it right away. Make sure that they have your right healthcare information for your plan. Sometimes it's the wrong code they use, so it's not correct. So you definitely don't want things to go into collection. So definitely think that over. And our office definitely helps with that. We're advocates, so we definitely just make sure that you are not going to get billed if, in fact, you shouldn't get billed. Okay. Some people just tend to pay it, not worry about it, but why pay something that's really not your bill, right? So be careful with that. Okay, so how do I file an appeal? How you file an appeal depends on the type of Medicare coverage you have. If you have original Medicare, get the Medicare Summary Notice, MSN, that shows the item or service you're appealing. Go to page 58 for more information about MSNs. Circle the item on the MSN you disagree with. Write an explanation of why you disagree with the decision. You could write on the MSN or on a separate piece of paper and attach it to the MSN. Include your name, phone number, and Medicare number on the MSN. Keep a copy of your records. Send the MSN or a copy to the company that handles bills for Medicare, Medicare administrative contractor listed on the MSN. You could include any information you have about your appeal, like information from your healthcare provider, or you could use Form CMS 227. Call us and we could get that for you as well. To get this form in English and Spanish, visit medicare.gov/basics, form publications, mailing form appeals, or 1-800 Medicare to have a copied mailed to you. You must file your appeal by the date of the MSN. If you miss the deadline for appealing, you may still file an appeal and get a decision if you can show good cause for missing the deadline. For example, if you have a disability, illness, or accident that delayed you from sending it by deadline. You'll generally get a decision from the Medicare administrator contractor within 60 days after they get your request. If Medicare will cover the items of service, it will be listed on your next MSN. If you have the right to a fast appeal, if you think your Medicare services from a hospital or other facility are ending too soon, page 100. Okay, so I wanted to touch on one of my clients recently that she basically was on original Medicare Part A. She was on her husband's coverage. Her husband left work. He got on Cobra. And so technically, you do have 8 months from when your credible coverage ends to get Medicare and not be penalized. However, because she applied for her Part B during that time period, and that was a 1 month gap, so she was on Cobra for 1 month. That Cobra plan wants to deny her claim because they said that she was already supposed to be on Medicare. But come on now, like sometimes Medicare takes the longest time to even get your Part B going or your Medicare going, right? And she had that 8 months technically to get on Medicare without any repercussions. So What I told her to do is definitely file that appeal. So it is work in progress. I will let you know what happens to that. Um, to me, it doesn't make sense, but this company or this insurance company trying to get out that she should have been on Medicare and she wasn't. I mean, she was on Cobra for 1 month while waiting to get her Medicare card effective date issued. So it's not like she wasn't waiting or waiting months for this. She was actually on top of it. So we will see and we'll go over that. Okay, so that's original Medicare. If you're in a Medicare Advantage or other Medicare health plan, the time frame for filing an appeal may be different from original Medicare in some cases. You can file a fast appeal to learn more about the materials your plan sends you. You call your plan at medicare.gov/claims/appeals/how do I file an appeal. If you have a separate Medicare drug plan, even before you buy a certain drug, you have the right to get a written explanation for a drug coverage decision called a coverage determination from your Medicare drug plan. A coverage determination is the first decision your Medicare drug plan, not the pharmacy, makes about your benefits. This can be a decision about if the plan covers your drug, if you met the plan's requirements to cover the drug, or how much you pay for the drug. You'll also get a coverage determination decision to ask your plan to make an exception to its rule to cover your drug. Ask for an exception if you or your prescriber, your doctor, or other healthcare provider who's legally allowed to write prescriptions believe you need a drug that isn't on your plan of coverage drugs formulary. I did mention that earlier. Ask for an exception if you or your prescriber believe that your plan should waive a coverage rule like prior authorization. Ask for an exception if you think you should pay less for a higher tiered drug because your prescriber believes you can't take any lower tiered drugs for the same condition. So that's something most really don't do, but it's a good point to get that. Instead of saying a percentage, pay a copay or co-insurance on that. So how can I get help filing an appeal? You could appoint a representative. That could be a family member, friend, advocate, attorney, financial advisor, doctor, someone else to act on your behalf. For more information, visit medicare.gov/claims-appeals, file -appeal/can-someone-file-an-appeal-for-me. Okay. You could also get help filing an appeal from your state health insurance program SHIP. Go to page 114 to 117 for a phone number of your local SHIP. So keep in mind, that's what an insurance agent is for, right? Our company helps helps you with that. Okay, so we are still on appeals. Our time is almost over for Medicare new handbooks. We're leaving off on page 100, and there's 28 more pages left. So awesome journey this year for that. And then I look forward to just more topics in the future, especially with annual enrollment coming up October 1st. It's almost there. Very exciting. The time where people can make changes and just a lot of disruption for years. So that's exciting. I will definitely go over this in the next few weeks just to get everyone going and situated with that. Because there will be changes, there might be plan terminations, lesser benefits, more benefits. So we will see. So appreciate you listening in. Thank you. My name is Jennifer Lee, your host for the Medicare 360 show. I look forward to seeing you next time. Have a great day.